These aren't my samples.
Well, we've been looking at comparing the new virus, ZOM8, to Ebola, which it has a lot of similarities with. Ebola, or Ebola hemorrhagic fever, has a very high death rate. Four of the 5 strains of Ebola are lethal to humans, but the lethality rate varies from 25 to 90%, which can be devastating to different communities. What we know about Ebola is that it is a filovirus, which means it has a very long, spaghetti-like body, but especially to Ebola, it has this very distinctive shepherd's hook at the end. Unfortunately, ZOM8 does not have this, so it's a little harder to recognize under a microscope. For the different animals Ebola's been able to live in, its reservoir is fruit bats, which means it is able to live in fruit bats without harming them. It's able to get around through fruit bats. But its vector, or how it gets to humans, more specifically through monkeys. When monkeys get the virus, Ebolas tend to be found in areas where humans eat monkeys, where they eat fruit bats, where they invade their ecosystem and environments. So when humans get this disease, it's not always from other humans. The frightening thing about this new virus, ZOM8, is that it can get through so many different species. There's hardly a species barrier at all. But what's scary through humans is that it can be spread through all bodily fluids. Saliva, blood. Ebola can be transmitted through semen 7 weeks after clinical recovery. And we're not entirely sure what this new virus is capable of just yet. Also similarities have been found in the symptoms. Ebola is somewhat hard to recognize early on. There's diarrhea, there's fever, chills, sore throat, even arthritis, which is very hard to recognize and differentiate from other diseases. But when Ebola develops later, the symptoms are frightening. There's bleeding from almost every orifice. There's your eyes swell. And many patients often develop depression. But we've been able to recognize Ebola through different tests. There's blood counts. You can test how blood clots. There's antigen tests. But it's very, very hard to recognize this ZOM8 virus because we're not entirely sure how to recognize it yet. But oddly enough, with Ebola, patients usually die from low blood pressure rather than blood loss, which is very different from this new virus, which people just bleed out. The only forms of protection from Ebola, of course, are just gowns, gloves, masks, and avoiding the infected. However, this is very difficult with this new virus because it's so unrecognizable at first. But like Ebola, there's no cure for either yet.
Wait a minute. This isn't the blood samples I asked for.
Recently, more animals have been coming to me with, symptoms similar to rabies, such as weakness, difficulty breathing, and swallowing. And then it's progressing, and, they've been having excessive salivation and abnormal behavior and aggression. And those symptoms are very similar to symptoms in humans, the abnormal behavior. Animals, although animals don't get hallucinations as humans do, we also have a rash at the bite where we got a bite, which is how humans typically get rabies. It's really weird. There are all these signs of rabies, but something's off. Something's not matching up. Usually I get 1 or 2 cases of rabies per year. Usually rabies isn't very prevalent in the United States or even Canada. It's more of in places like Africa or developing nations. Rabies typically, you can get in previous or pre-exposure vaccination, which will help with rabies, and that's what you get for the treatment. And you help with the bite wound. You clean the bite wound, and that's what you treat. And I usually tell my patients to just get regular checkups, to spay and neuter their pets, keep them indoors with their cats, just regular stuff like that. And just, something different about this. I'm seeing more and more cases of rabies per week. I've been studying the virus, blood samples of the virus, and something is different about this strand. Unlike the rabies, which has a rod shape and glycoproteins and an envelope and matrix, there's no envelope and there's a matrix, but it's so unlike rabies, and it's different. I'm not understanding. It's rod shaped, yes, and there's glycoproteins, but it's not the same. It's nothing like I've ever seen before.
BNL Action News Channel 4. Hello, I'm Dade Archer, and we're here to give you all the latest and breaking news about ZOM8. ZOM8 is much like Ebola and rabies, meaning it's almost like a hybrid virus. There's symptoms from both, such as bleeding from all the cavities, fever. There's often flu-like symptoms. So it's very tough to tell if you do have ZOM8. We're still trying to locate and pinpoint who exactly patient zero is, but reports are coming in saying that we're narrowing down on someone in the Dayton area. And it's actually not just contained to that region. We've gotten reports from all over the United States that it is spreading. We're not exactly sure how fast it's spreading, but at this rate, it's more than likely going to be worse than the 1914 Spanish flu. So just be careful. Try not to touch people. Try to stay indoors as much as you can. Get a lot of fluids. There are the CDC has reported that their best people are trying to work on a cure. So just stay safe and remain calm. I am Dieter Archer.
Dr. Green?
Yes?
Hi, I'm Dr. Rainey. I work over at the vet across the street. I've been looking at my patients' records, and a lot of them have been coming to me with rabies. It's really weird because I only get 1 or 2 cases a year. And they've been experiencing the regular symptoms of rabies, which is, excessive salivation and hallucinations and difficulty breathing and swallowing. But something's not right. They've had low heart rate and bleeding out of the orifices, and they've had low blood pressure, and it's a filovirus.
Well, that sounds like Ebola, but Ebola's been under containment. It's only natural to Africa. But have you heard of this new virus, ZOM8?
Yes, I have.
I've been seeing it more and more in humans, and I thought it was similar to Ebola, which is frightening in itself, but it's been having rabies-like symptoms.
Yeah.
But it doesn't make sense. I mean, I've been getting it in humans, and you've been getting it in animals. There's no way it crossed the species barrier that fast.
I don't think there is a species barrier.
Oh, I got this blood transfusion a couple days or weeks ago or something, and ever since then I've been feeling so just bad. Just overall, I have a bad, terrible cough. I've been just feeling down, and I've been having this stuffy nose, and just been coughing, and my stomach hurts, and I think my whole body's been aching, and I feel tired all the time. It's just not fun. Ever since I got that transfusion or whatever, okay, cut. Oh God, I cannot do this.
Okay.
Oh God. Oh. Oh God.
Mr. Archer? I'm Dr. Green from the local disease research lab, and this is Dr. Raby from the local veterinary office. Yes, we've been getting reports of a disease that's spreading to both animals and humans. I've only been getting data from humans, and she's only getting data from animals, but the symptoms range from Ebola to HIV, rabies, and chickenpox.
That's quite odd. Would you guys think it's related to this new ZOM8?
We don't know. It's got such a wide range of symptoms, we can't trace it. But we're only getting data for individual species. We need to know what reports you've been getting.
I know I've been getting data from around the country. Okay? Okay. It's global!
Guys, I think I've got it.
We found it!
Oh,